There's a scientific paradigm change that needs to happen. And doctors are starting to get that this is true. And I think it's not that they're trying to do something harmful or bad. They're just stuck in a system. But this is a great idea. If we create these lifestyle change programs for Medicare, people are going to get better. They're healthier. We're going to reduce healthcare costs and improve healthcare outcomes. She said, but who's going to know how to do it? I said, don't worry about that, because if you pay for it, people will figure it out. If you pay for an angioplasty, if you pay for an angioplasty, doctors are going to learn how to do angioplasties, right? You don't have to worry about that. If you pay for a lifestyle intensive change program that works better than, this woman I was telling you about, she had $20,000 of copay. I don't know what her other medications cost for the insurance or the healthcare system. Plus, she was in and out of the hospital all the time. We probably saved the healthcare system $1 million. I got paid $200 for the visit. We don't get the benefit as doctors for doing the right thing. We get benefit for doing the wrong thing. We get benefit for paying more. For doing more, not doing the right thing. So it's a reimbursement-based system based on fee-for-service and throughput, not based on outcomes. Imagine if you were making cars and you had a car company that produced cars that didn't work, or you drove off the lot and they just fell apart after a few years, or they had to come back constantly to get fixed every month. You wouldn't have a car company. No. But that's what we do in medicine. No, you wouldn't. That's what we do in medicine. We have a system that doesn't really fix the problem, and people, are not actually getting the solutions that the science says work, like the things we've been talking about on the show. So I think we have a historic opportunity now. It's fraught, right? There's going to be trillions of dollars at stake here, Tucker. Trillions of dollars in the food industry, in the ag industry, the fast food companies. All these companies are going to be frightened about this. And they are already circling the wagons. They're already coming around Washington, working on discrediting everybody in this administration. They're pushing back hard because they know day of reckoning is coming. And I think it's time. The American people should not be the victims of this system. Like I said, 93% of us are somewhere in that spectrum of pre-diabetes to type 2 diabetes. That's frightening to me as a doctor. That's just like, when I was in medical school, this wasn't a problem. There was no juvenile diabetes where kids had type 2 diabetes.